A recent study shows an estimated 19 million American adults are living with depression. And here to talk about depression, its causes, and of course ways to treat it, is Catherine Petrasic, Director of Psychiatric Services for Wellness Solutions of Tennessee. And of course, we all want to give you a big talk of the town welcome.
Thank you. Thank you for having me.
This is a subject, it does have a lot of stigma with it, but it's one of those things that everybody is sad from time to time. So how in the world do you know whether you're depressed or not?
The difference between?
Exactly.
Yeah, depression is it's persistent sadness and loss of interest, loss of motivation. You can also have some physical signs and symptoms that a lot of people will present to their primary care physician with aches and pains and just, I'm not sleeping, they're gaining weight, losing weight. And so sometimes it can be a little tricky to put your finger on it. However, it's more than just the blues. You know, it can start as an adjustment disorder due to a life change, an environmental stressor, substance abuse, and then grow into a more chronic illness. And so it's not something that you can just snap out of.
Is there a physical cause? Is there a mental cause for depression?
It varies client to client, patient to patient. Sometimes people can have thyroid abnormalities. Their hormones can be out of balance. And like I said, sometimes it's environmental stressors. And then there is just the neurobiology of it. And sometimes you can't really put your finger on why I feel this way, but I know I feel this way, and eventually you need help.
Right. And there's nothing wrong with asking for help, but so many people are afraid because of the stigma associated with depression. And I don't understand that, because if you have a heart problem, you take heart medicine.
Exactly.
You know, if you
have diabetes, you see your doctor, you get treated for it.
Exactly. So what about that? I mean, and what can we do to ease that?
You know, I find that, you know, over the times, you know, and all the different research that we've done, it still is present. However, it's less present. The stigma is with modern times. However, it is still there. And you know, at Wellness Solutions of Tennessee, what we try to do is when people decide, hey, I'm going to go get some help, it is almost like a leap of faith. They're really, it's nerve-wracking. So when they call and they're met with, oh, well, we can see you in 3 months. You know, sometimes the waits can be very, very long. It's discouraging. And so our goal is to get people in, get them in quickly so that that stigma doesn't have time to set in. And then also once they get into treatment and we individualize their treatment plan, we then start helping them address and take some ownership of the way they're feeling, and also ownership of the fact that they can change it. And so then that gives them a sense of control, power, and helps confidence and self-esteem, and then all of a sudden the stigma doesn't even matter anymore.
So how quickly, and like what, are you talking about medicines, and then how quickly will somebody feel better?
It varies, you know, person to person. Some people can get a little bit better within a few weeks. Some people it takes months. Some people it takes years. But the main thing is not just looking, oh, here's a pill, you'll feel better in 4 weeks, call me. It's maybe medication, but also psychotherapy is a huge, huge piece of this. And it's proven in the research that the combination of psychotherapy plus medications is very powerful. At Wellness Solutions, we also like to look at what else is going on, like we were talking about earlier. Medical causes. You know, is it your thyroid? Is it hormones? Are you drinking too much? You know, not necessarily alcoholism, but are you having some poor coping skills? Can we start giving you some healthier coping skills? And also incorporating an integrative approach. We also do natural treatment. Some people don't want to take a medication. They want to do a supplement or a vitamin approach.
But the key is to ask for help. And Catherine, thank you. You've given so many people some help and some hope today. I know for sure folks that are watching. So if you would like to schedule an appointment or maybe just get more information about the treatment of depression, we're going to link you to wellnesssolutionsus.com.